This meeting is being recorded.
Go ahead, Cynthia.
Is everybody admitted?
Yes.
Oh, okay. Hello, everyone. My name is Cynthia Baker, Executive Director of CASN, and I'd like to welcome you to this webinar. I'd like to start with a land acknowledgement. CASN's national office is located on the traditional territory of the Algonquin people, and we would like to acknowledge and pay respect to the Algonquin people who
Sorry,
are the...
I forgot my headphones, so I'll have to turn that on.
Who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region and in all regions across Canada. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. So today we are honored to have Dr. Nancy Edwards provide a presentation on a topic that's becoming increasingly important in our world. You will have read a bio of Dr. Edwards when you registered for this webinar, so you know of her past accomplishments and also that she is a professor emerita currently at the University of Ottawa in the Nursing Sciences, Faculty of Health Sciences. Dr. Edwards, we look forward to hearing your presentation entitled How Schools of Nursing in Canada Can Contribute to Achieving United Nations Sustainable Development Goals. So we will be recording today's session and following Dr. Edwards' presentation, we'll conclude with 15 to 20 minutes of questions and answers. And if you have a question, you can submit it using the chat function. So let's get started. Over to you, Nancy.
Oh, well, thanks very much, Cynthia. Delighted to be here. I have a bit of a cough, so if I suddenly mute myself, it's because I don't want that on the recording, and Dawn will be my backup. So really pleased to be speaking to you about this important topic, and I think it is one that's getting a lot more attention in the nursing world and elsewhere. Just see if I can get this to go forward, and it's not forwarding. There we go. So just what I thought I would do is give a brief history of the Sustainable Development Goals, and then we'll take a closer look at one goal in particular and examine its relevance. I'd like to talk a bit about Canadian post-secondary institutions and Sustainable Development Goal implementation. We'll talk a little bit about competencies and principles, and then nurses' contributions. And I'd like to put forward some ideas about a way forward, and I think you'll also have some really good ideas to propose as well. And I'd just like to encourage you to use the chat throughout. If you have ideas and examples of how you're already incorporating content and experience related to the SDGs, and I'll use that acronym in your work. And just so that I know you a little bit better, Dawn's going to put up a first batch of some polling questions. So if you can take a few minutes to answer these, and then we'll show you the results. And there's 3 questions, so if you can answer them all, that would be great. Just give you another minute or so. Dawn, it looks like most people have answered. Did you want to show us the results? So there we go. How familiar are you with the SDGs? It looks like most people are at least somewhat familiar. So that's great. The next question was about pertinence and whether you felt they were more pertinent to low-income countries than to high-income countries. And it looks like most of you disagree. So I guess you wouldn't be here if you all thought strongly that they were only pertinent to lower income countries. And SDGs should be explicitly included in nursing curricula. Strongly agree. So that's very interesting to know as we get started. So that was sharing the results. I guess I was looking at them and others were not. Is that right, Don?
Yes.
There you can see the
Did
results.
others not see it? Sorry, I thought they could.
No, I think we're good.
Okay.
Okay, thank you. So we'll just take that poll down.
Is it not down?
I took them down on my
Okay.
on my system, so hopefully they're down on everybody's.
Yep.
Always a few little glitches with Zoom, right? Just trying to get the slides to advance here. We don't want to advance. There we are. So how do we get to the SDGs? Well, it's really been a 50-year history dating back to the United Nations Conference on the Human Environment that was held in Sweden in 1972, just a couple of years before I graduated, but I don't remember hearing anything about it in my nursing program. And then the report of the World Commission on Environment and Development, or Common Future, came out in 1987, and that became known as the Brundtland Report. And this early work, I would say, was particularly focused on environmental issues, including the Earth Summit that was held in Brazil. And then it led up to the Millennium Development Goals in the year 2000. That was unanimously adopted. That was those goals covered a 15-year period. And you've probably heard of those since you're very familiar with the SDGs overall. There was 8 goals. A particularly important one, I think, was the eradication of extreme poverty and hunger. You can see that several of those goals are very specifically health related. They're reducing child mortality, improving maternal health, and combating some specific diseases. And there was a very strong environmental component as well. And then developing a global really approach for sustainable development was a sort of an overarching goal viewed to be very important. So health was strong in those goals. And I'll just use one example. There's been a lot done to look at the progress that was made. You can see here progress on improving maternal health. And there was quite a decline in the maternal mortality ratio, which really we started to see it in 1990 before those goals were in place. But a lot of the progress on those changes happened after the Millennium Development Goals came into place. There was some variability, of course, in different parts of the world, and a movement towards more births being attended by skilled health personnel. And it really was, I suppose, a bit of a case study, in a sense, a universal case study on whether or not global action worked. And the main conclusion, I think, coming out of the effort on the MDG agenda was that it does work and that we need a new development agenda to leave no one behind. And it also taught us that if you've got a measurement framework for development, with all countries that sign on being accountable for the changes, assessing the changes that take place, that also helps move things along. And you'll all remember also during this period that there was a lot of work done on tobacco control internationally. And although that's not specifically under the MDG, it was another exemplar at the time of how changes that people agreed to and were having to account for at the country level made a big difference in terms of progress. So overall, there was substantial progress made, but it was uneven, and some health inequities, such as maternal mortality rates, worsened, so that we were widening the disparities around some of the health outcomes. There was a lot of discussion then about whether or not in formulating new goals, should they move to something that was a zero target? So, complete eradication, for example, of poverty, or halfway targets for the next 2030 target. And you'll see in the new Sustainable Development Goals that there's actually quite a mix of both. zero targets and halfway targets used. Some stakeholders thought that goals with an explicit focus on health were inadequately reflected in the SDGs because there was 3 goals out of 8 in the MDGs. There's actually only 1 explicit health goal in the SDGs. And there was ongoing questioning about, what is the role of health professionals in addressing goals outside the health sector, like poverty and climate change and sustainable cities and so on. So just to continue the story about how we got to the SDGs in 2015, there was the Declaration on Sustainable Development that came out in 2002, continuation of that in 2012 in the Rio conference with a document about the future we want. And then a working group was set up in 2013 to develop the proposal for the SDGs. And they were adopted in 2015 as the MDGs came to an end. And there's 17 goals and 169 targets. So they're very ambitious. And I think one of the most important things to note is that the goals are considered indivisible. So it's not about working only in one sector, only in one goal. The goals together progress must be made on the goals together in order to make the achievements that are envisioned. There was a number of other policy shaping agreements that happened in 2015. And one I'd like to point your attention to is the Addis Ababa Action Agenda on Financing for Development, because we still got a legacy, as we know in Canada, of colonization with our indigenous people in particular. And that legacy of colonization exists throughout much of the so-called developing world, particularly around financing for development, whether that be coming from aid agencies or the World Bank and so on. And so this was an attempt to re-envision what that financing needs to look like. I think somebody's maybe needs to mute their line because we can hear them. And Dawn, maybe you can mute them from your end. There was also a high-level political forum that was set up at the time, and that's a platform for countries to come together every few years to assess progress on the goals. So these are the goals. I'm sure you've seen this diagram before. It's around and in various versions of it. But as you can see, there's 17 goals. The last 2, peace, justice, and the one on partnerships, are really what needs to happen for other goals in particular to be achieved. And the first goals, I think it's 1 to 6, are an expansion of and a further articulation of goals in the MDGs. And here's the goal related to health, good health and well-being. And then the next set of goals, 7 to 10, address more of the root causes of poverty and inequality. And goals 11 to 15 look at how humans are having an impact on the natural environment and how that impacts consequently on social and economic development. So each member state that has signed on to the SDGs is responsible for developing a national action plan. And although it is considered relevant to all federal ministries, there is generally a lead. And in our case, at the current time in Canada, the lead for the Sustainable Development Goals is Employment and Social Development Canada. But a whole of society as an effort is really needed to achieve them. Of course, COVID threw us for a loop in so many different ways, including the SDGs. And it really was, I think, a setback for the achievement of the goals because so much effort was sidelined and put into dealing with the pandemic. And of course, some of that continues. But there was a regrouping and a ministerial recommitment in the end of 2021, 2022, where they really looked again at the goals, determined their relevance, and determined that this was a chance for us to build back better from the coronavirus disease. And while it has set us back, in some ways, I think it's opened up some different opportunities that may not have existed before about how we think about inequalities, because COVID brought to our attention inequalities in a big way, about how we think about working together, as was done around vaccine, and how we can accelerate the recovery from COVID-19. So it was determined in this General Assembly resolution that
Nancy, you're on mute. Nancy, we can't hear you. You're on mute.
sorry, I touched something on my screen by mistake. Could you hear me on anything about this slide? I'll continue from where I left off.
Okay.
So I was just saying that coronavirus, really created a problem in the works and towards acceleration, but we're trying to get back on track with the SDGs and looking at how to build back better from the coronavirus. And Canada is one of 42 countries now that's undertaking a voluntary review on SDG progress, and we'll be reporting on that for 2023. And Canada reports on our own set of indicators related to the SDGs, as well as the general indicators set up for all countries for the SDGs. So if you're interested in some of the documents related to that, I've provided a few resources here. But this is a statement of sort of where some people think we're at. Peter Singer, who many of you will know, used to be at U of Toronto, now works with WHO. He estimated this in August that progress on the SDGs is at about a quarter of the pace needed to reach the goals by 2030. So we are behind, but all the more reason for nursing and nurses to get involved, I think. So let me look at relevance of one particular SDG, and purposefully, I've not chosen the SDG specific to health. Rather, I've chosen one that we might consider to be predominantly in another sector, and that's the SDG about ending hunger, achieving food security, and improving nutrition while promoting sustainable agriculture. So this might, lead us back to the question, are most of the SDGs that are outside of the health area within our remit? And I feel very strongly that they are. I just provide this citation here because I think I found it to be a very good article that looks at the role of agriculture in achieving universal health coverage in Africa. So while we're talking here about another continent, it reminds us of how interrelated these sustainable development goals are. And as we have issues in one sector, if we don't support our agricultural sector, it directly impacts on people's health. Food Secure Canada is a really good example of a non-governmental organization that's trying to work on advancing the SDG with respect to food systems, both in Canada and to some extent internationally. And you can see here some of what they are committed to, including things like labor exploitation of farm workers in Canada in the name of profit. How do we support small scale food producers? How do we diversify protein supplies? And how do we rethink some of our biodiverse agricultural systems? And this just gives some more specific examples of how this NGO is trying to engage with this SDG. They're looking specifically at three main focus areas, which are equitable access to healthy, sustainable food, indigenous food sovereignty, and healthy school food. So this, I think, is looking at this particular SDG through a number of lenses that I view as being highly pertinent to nursing. So if we look at it through a determinants of health lens, then clearly poverty, and precarious livelihoods and food supply chains are all determinants that impact on food security, and food security itself, of course, impacts on people's nutritional status. We could also take a disease or illness perspective on this, thinking about One Health issues, which have certainly been top of mind with the pandemic, also the avian flu, and so many livestock that have had to be destroyed, culling of chickens and so on as a result. Obesity and diabetes, cardiovascular disease, dental caries, injuries in farm workers. So I point those out because whether you're teaching medical surgical nursing or community health nursing or health inequities, I think you can bring in the relevance of various SDGs into that work. And then, of course, that equity lens of food security versus insecurity, and much talk about that in Canada at the moment, as we know, because food costs are going up so much. What about inner city food deserts or food banks and homelessness? We've never had so much pressure on our food banks as we have at the moment. What about breakfast programs for children and their readiness to learn? And the health and living conditions of seasonal immigrant workers, which got a lot of attention during COVID because of some of the deplorable conditions that they were facing when they came to offer seasonal work in Canada. And I won't go into any detail on this, but it's just an example of how Food Secure Canada has taken the Sustainable Development Goals, looked specifically at school food programs, and offered approaches and strategies that we might embark on in Canada to contribute to meeting the goal in Canada and globally. And I think there's some very specific, concrete ideas here that I found very interesting. So what about how our Canadian post-secondary institutions are doing on SDG implementation? And here I'm going to get Dawn to put up our second batch of questions for you to answer. I'm hoping everybody can see that. There's 2 questions this time. Give you a few more minutes. Just another couple of minutes for people to finish answering. So Dawn, why don't we close the poll and share the results? So to the first one, has your educational institution made a public commitment to achieving SDGs? The largest proportion, 48%, weren't sure. And the second question was whether or not your school or department has discussed how to incorporate content related to SDGs. And it looks like the majority have said no, or they're not, don't know, or they're unsure. And sorry, there was a third question. Do any of the strategic directions for research in your school align with the SDGs? And again, it looks like the majority have said either no, or they don't know, or they're not sure. So certainly maybe some questions that you want to take back to your own department and so on to fill in your gaps in knowledge about that. Dawn, we can take the poll down.
I think I've taken it down.
Great, and I have too. Always takes a second for it to register. There we go. So I think these are some other questions that you might want to ask in your institution. and perhaps start some discussion with your colleagues about this. I wondered, for example, whether or not there's any institution-wide committees at your institutions that discuss SDGs for faculty and or students. Does your university and college actually have an office of sustainability? Might be something else that you want to ask about. And you answered the question about SDGs being explicit or not in the curriculum. We started to answer that. But there's a very interesting survey that I came across that was put out by Universities Canada in, the report came out in 2021. I think the survey may have started in 2020. And they give a bit of interesting background on the incorporation of environmental sustainability foci within universities earlier than either the MDGs or the SDGs. And there was a declaration signed at Ottawa, France, which was a 10-point action plan to incorporate environmental sustainability into higher education. And as a result of that, there's 70 or more universities across the country that actually have some form of sustainability office or some structure in place to try to advance sustainable development. So many universities have actually built on those early structures as we've looked at both the MDGs and the SDGs. And there is actually a tracking mechanism to look at rating progress towards sustainability. And in the recent survey, they looked at a number of things, and this really is for your information, so I'm not going to go through all the results by any means. But they found that about 30% of all universities in the survey did include SDGs as one of their main strategies. And there's quite a range of examples that they provide from universities across the country. In some cases, it was setting goals. In other cases, it's part of a conceptual framework. Dalhousie's built it into each of their signature research clusters for the whole university. Some universities are putting out regular reports and reporting to the public on their website. There's a big population health research network that's been going strong in Quebec since 1990, but it actually has reoriented their global health cluster towards the sustainable development goals in the last couple of years. So they're trying to really explicitly build in attention to those goals in the work that they do. Coming back to the University Canada's report, there's quite a few examples of how students are getting involved, and often across disciplines, across faculties. Some of them have organized special sustainable development goal days, or looking at placements for students with a focus on sustainable development, or working with a community on sustainable development goals. And I think one of the things that you may be asking yourself is, well, where do the actions of our Truth and Reconciliation Commission fit in with this? And there's a little bit of this discussed in the University of Canada's report. And a point that they make that I don't entirely agree with, but they just said that, because there is no specific SDG regarding Indigenous rights and reconciliation, that harmonization of the SDGs and initiative with our Truth and Reconciliation Commission action items is a challenge. But they point to the fact that universities should be implementing the SDG agenda with full respect for the rights of Indigenous people, and both protecting and promoting those rights. And this is where the SDGs really join up with other declarations on rights, and specifically Declaration on the Rights of Indigenous People. So we can think about these macro policy initiatives, which are sort of one side of a nutcracker, if you envision a nutcracker. And Fran Baum talks about this. So how do we get the upper echelons, the global level, the national level, the university level, and so on, working together with the community to crack the nut of inequities, to crack the nut of sustainable development, and so on. And we can invoke other macro declarations that Canada has signed on to, such as the UN Declaration on the Rights of Indigenous People, in those efforts. And in fact, the government of Canada has worked closely with the Assembly of First Nations and the Métis National Council and the Inuit Tapiri Kanatami organization to define approaches to achieving the SDGs. And they've got documents that outline in a lot of detail how to put those human rights up front, how to combat the inequalities, and what are the Indigenous priorities as viewed by these organizations that relate to the SDGs. So there's a lot of that thinking that's been done for you. And I think that's a really good place perhaps for schools of nursing to start, because I know there's a lot of work going on across the country around the Truth and Reconciliation Commission action points. So let's look at some SDG competencies and principles. And this is my view on some of the fundamental competencies that I think can be taught using SDGs as a basis for exemplars. It's not intended to be a complete list. I've not disaggregated those that I think are more relevant for undergraduate programs versus graduate programs. I think that's all in your hands. I'm retired now, so over to you, and you'll have lots of thoughts on that. But I just see so many competencies that can be addressed by looking at SDGs, and not only the SDG in health, but the SDGs in other sectors. Leadership at the bottom of the list being one of them. And what I'll dive into now is just some thoughts on some specific areas, clusters perhaps of competencies and of approaches that we know are really important, not just for meeting SDGs, but for improving health overall. And where, again, I'm not going to say whether I think it's an undergraduate or a graduate competency. Some cases I think it's both, but where I think attention needs to be paid as we look at how to contribute to the Sustainable Development Goals. So the first of these is policy coherence. So this is talking about how do we have a coherent policies that don't contradict each other across sectors. That's the horizontal policy coherence, but also between system levels, the vertical policy coherence. And if I just go back to the example of tobacco control, it's a really good example of where we still have some ways to go, but it was in achieving that policy coherence that we really made some inroads on the use of tobacco intercountry. And of course, we've seen some slips in that as well with vaping, et cetera. But policy coherence really gave us some mega steps and helped to make really good progress on the issue. And human rights, I think, is the other approach. And we can see, we know that human rights actually trump any legislation. And we can see how people are using our signatories on human rights to bring issues of accessibility and so on to the attention of different ministries, and trying to get more policy coherence in what it is that helps us get to human rights. There's global networks for health and all policies, just as examples of what's available out there to think about policy coherence and multi-sectoral collaboration and what that looks like. So I would just say there's lots of resources for those who are not familiar with them that can help us, I think, in teaching on this. October 10th, next week, is actually World Mental Health Day. So if we're looking for an example that's squarely in the health arena, this report, I think, is a really good example of a report that's looking at comprehensive mental health action and the Sustainable Development Goals put out by WHO. So here's that upper lever again on our nutcracker, trying to push countries to think about how to promote and protect mental health. And we all know that there's been much discussion and much concern about mental health coming out of COVID. So I think this is a very timely report. There is a vision for transforming mental health for all. And of course, it's written for the global community, but I just pulled out a couple of examples there that I think are very fitting also for Canada. And they're creating a vision for how we move from little acknowledgement of the underlying determinants of mental health to real multi-sectoral collaboration on those determinants, and moving from mental health that is only or largely provided in the health sector to mental health care that's embedded in services across sectors. So whether or not you teach mental health, whether or not that's part of your research agenda, although it's hard to imagine a nursing topic where it doesn't play some role, I think it's a good exemplar of how we can build in discussions about policy coherence in the work that we do. The second area is gender responsive and transformative approaches. And I've just put in here the continuum from gender discriminatory programming to gender transformative programming. And of course, we're aiming for the gender responsive and transformative end of that continuum. And there's been a lot of work that's gone on, some of it led by Canada, but as you all know, we still have a ways to go. And maybe I'll just give you a little task for a moment. So I want you to, if you're in Atlantic and Northern Canada, just think about the initiatives here in red. If you're in Central Canada, have a look at the 3 in black, and Western Canada is the 3 in blue. And just want you to think about whether or not you see those as being gender benefiting from gender responsive or transformative programming. And I'll just give you a minute to read them and think about it. If you want to offer reflections in the chat, you're welcome to. So as you see, I put in quite diverse examples, but I could not come up with any where I did not think they might benefit from gender responsive or transformative programming. And of course, these examples are all at different stages of getting to that end of the continuum. I would say that our correction system is an example of where we've fallen behind. Maybe we're further ahead on programs around parenting. I'm not sure, but there's just so many ways in which we need to build this in, and this is going to help us contribute towards the SDG on gender equality. Canada has a strong feminist international assistance policy, which actually has been adopted by a number of other countries, and I've just given you some highlights from it here. But it is a good example, I think, to use as we think about how do you build in action areas into different sectors around meeting gender equality. And Canada has also been at the forefront, with others, of course, on developing tools that allow us to assess gender-based equity in our programs, to look at things like gender responsive budgeting, which reflects not just how we need to think about that for our global aid programs, but also how we think about it at municipal levels as we look at gender programming around physical activity programs, around caregiver programs, and so on. And many of you may be familiar with the training modules that the CIHR Institute of Gender and Health has that is recommended, if not required, for anybody seeking funding from that particular institute. So the next one I'll move on to is coordinating across all levels of government. And this really goes hand in hand with the policy coherence, but it brings attention to a process of how we actually get to policy coherence. And this involves often a vertical coordination mechanism from municipal right up to international. And it means that we're working with different authorities. And by that, I mean, for example, under our Constitution, Housing and education and health, as we all know, are provincial jurisdiction. So you can't work solely at the national level on any of those areas. You have to be working provincially, and I would argue municipally as well. We have different funding bases for different levels of government, particularly at the municipal level, where they're very constrained budget-wise because they rely almost entirely on property taxes. We have different public pressures like lobby groups that bring different kinds of pressures and different kinds of groups with their asks to different levels of government. And of course, we have different electoral and policy cycles, which don't always help us get that coordination right. But I think there's many examples of in Canada right now, some of which are very, really quite recent in terms of some effort that's moved them forward, that are about this coordination that's needed, whether we're debating minimum versus living wages to help take people out of poverty, whether we're talking about universal and affordable daycare or dental care, affordable housing, and aging in place strategies that are really important as we experience the demographic shift that we're all part of. And finally, incorporating Indigenous ways of knowing and leadership models. And I think there's a number of people on this call who are really working on this agenda. But I would say that, to find the path forward around the Sustainable Development Goals, we have to know where we've come from, and we need to think about what we're doing on the Indigenous front and consider approaches that are being taken to decolonize and that leadership for decolonization. There's some really good resources here that I've highlighted that you may be familiar with, but that give us some of the retrospective that helps us understand where we have come from and how we can go forward with the incorporation of Indigenous ways of knowing. How do we handle and tackle our approach in a more holistic way, in ways that are more relational, in ways that get us to think not only about our relationships with people, but also with the land. And Indigenous knowledge, I think, can really help us there. We work in a healthcare system which is largely a Western model of healthcare, with its hierarchies and governance structures and so on that all fit with that. But it has served us well in some ways and not well at all in others. I think it's time for us to learn from Indigenous ways of knowing moving forward. And to look at leadership models that are different than what is in our Western-centric approach. Think about how we choose our leaders, how we connect, how leaders connect, and how we build the kind of leadership that we need for the future. So just a few ideas about the way forward before we turn it over for a chat. These are just some initial impressions I've had from discussions with colleagues as I was preparing this talk. And what I'm hearing is a lot of attention being placed on issues of diversity, inclusion and addressing calls to action of the Truth and Reconciliation Commission. But overall, there seems to be a lack of nursing policy statements and resolutions and position papers specific to the SDGs, other than those just restating that nurses on multidisciplinary healthcare teams have a role to play. I think there's a tendency, is what I'm hearing, to silo competencies related to SDGs in community health and public health courses, and just kind of assume that they're taking care of it and that it doesn't belong in other nursing courses. And I think a more implicit rather than explicit mention of action on SDGs, and perhaps that was reflected in some of your responses to the last set of questions. Here's just a few examples of some recent articles about nurses and SDGs. The first one written by a PhD student who brings to our attention 3 goals. So good to see attention being brought to a goal outside of goal 3 on health. Some have written, like Dr. Bossy, on the relevance of SDGs to the history of nursing, and Nightingale, and pointing out that the foundations for it have been there for a long time. And some work that's been done on thinking about participatory approaches that we might use to act on sustainable development goals. I also looked at the ICN, which does make some statements about nurses being key to the achievement of the SDGs, and without nurses, we can't succeed. And some comments on why should nurses care about the SDGs. Nothing there that will surprise you if you haven't seen these statements yourself. Makes reference to human rights and social justice, and these goals affect our community. Our voice is important. We've got 20 million nurses in the world, so we've got a huge critical mass. But overall, although I don't disagree with the ICN statements, they sound a bit to me like platitudes. And I think it's time for us to ask ourselves, how do we move to action and outside our comfort zones and work with other disciplines outside of health and other sectors to achieve those SDG goals? So I think this really is getting close to my entree for you to offer your thoughts on this. Are there some common priority areas that schools of nursing in Canada could work on to advance one or more SDGs? What about those nursing competencies that I mentioned briefly? What about looking at alternate clinical and policy placements with an SDG focus and orientation? And I know there was a lot of work done as a result of COVID on looking at alternate kinds of placements for students. So I think you've done some of the work on that already. How do we use SDG exemplars to review things like human rights and accountability frameworks and measurement indicators, and to be able to have a cohort of students who do a better job at analyzing statements from multilateral organizations and can apply a gender responsive framework to policy documents, for example. And perhaps just a few ideas to get us started on some potential joined up efforts that we could consider. Having a presence on university councils and leadership tables with a focus on SDGs. Of course, that requires knowing what those are. Maybe some modular elective courses that could be used by schools across the country, as I understand is being done for some of the indigenous courses, so that we don't all have to start from the beginning to develop these courses. And perhaps there's some universities that already have some. What about a common SDG priority? Developing a plan of action that schools of nursing could collectively impact. Not everybody would need to sign on to it, but let's look at that collective action that might move us faster and further. What about getting students linked up with other disciplinary courses, elective courses that they could take in other institutions and use for credit in their own program? What about the position papers, motions, and resolutions that we might bring forward on activities related to the SDGs? And what about some opinion pieces on that maybe have been prompted by some of the things that I've said and what you agree with or what you don't? So I think we'll open it up for the chat right now. And Dawn, the final polling we'll maybe do just before we finish off. Those are just some conclusions. I'll leave you to read those, but let's see what people are asking. I'm just going to read out some of the ones that people are putting up here. And I think you can unmute yourselves to speak as well if you'd like to do that. Some looks like you're introducing this in courses. That's an interesting comment, Linda. You don't see I guess you're talking about the SDGs, are you? Or the continuum that I put up about being responsive to gender diversity? I think the goal on transformation, and I would say responsiveness too, although perhaps not explicit in the brief wording I gave you, actually is about responding to gender diversity. but perhaps that didn't come through so much in the statement from the continuum. Linda, you offer a suggestion about maybe where to start. I don't know if you want to speak to that. Getting SDGs explicated in provincial nursing competencies and standards. Lori, we have many people in remote and rural places. I think this is true in many countries, and there are, I would say, lessons to be learned from many different settings about programming in rural and remote locations. And I think this is one of the advantages of global action, of people sharing what works in one setting that may work in another. And I would urge people to think about the kind of innovation that often comes out of lower income countries, because when you're resource constrained, you have to find innovative approaches. Sometimes we've got too many resources in Canada, and it can actually stymie innovation. Yeah, that's a really good point, Melanie, about maybe students feeling powerless. And I think this comes back to this nutcracker effect. So, the SDGs are really high level. How do we actually bring in concrete actions that can happen at the local level for action? And I think that Food Secure Canada example is doing just that. Abigail, you had a comment. Please feel free to unmute and add your 2 cents worth.
Thank you. I'm sorry to interrupt. I'm just thinking about, I think I'm going to divert a bit to the thoughts of more on SDG, but I think it's related as well. I'm one of the faculty on several college and university, and I'm also a full-time registered nurse in one of the biggest hospitals in Toronto. I'm wondering, usually whenever I see students, and also I'm focusing on in the classroom, related to the goal of United Nations, like a sort of, I'm reading ahead before I'm attending your session regarding SDG. They said governance and engagement, and also human rights implementation, as well as principle implementation for labor. But focusing on what is happening right now, I think it's all over the world. As my manager kept on saying, we work really so short, sometimes it's 3 nurses understaffed. So it's like the plan and the thoughts that you want to share to the students, it's not really achieved. So what is your thoughts about this situation? How can we advocate, and can be me as one of the staff, how can be more a sort of resource to promote the goal of UN?
I think that's a great question, and probably one that we're all asking ourselves, given the reality of staff shortages and so on. But of course, we do have staff shortages, and it's not just in Canada. If you think you have staff shortages here, look to a lower income country. So it's finding those concrete action steps that we can each take. It may just be, for instance, if you're not consistently using sort of a gender responsive lens to your work, becoming more familiar with that. Perhaps that's part of your own continuing education objective that you want to create for the next year, and trying explicitly to apply that in your workplace, and seeing what comes out for you that you might want to discuss with other staff nurses, other clinical staff, your clinical manager, and so on, about things that you think are being missed, maybe in the way that you're doing discharge education, maybe in the way that you're involving family when you've got couples who are of the same gender, and so on. It may just be those small things, but the collective of those small things can make a big difference. It's like, dropping a stone in the pond, and you get that ripple effect from the one stone. So each of us has a handful of stones that we can polish and shine and make work for us with a ripple effect in our workplaces. Some of the things are more time consuming, and maybe these are things that you feel strongly about as a citizen, and it's something that you want to contribute to in your off hours. Others are things that I think we can immediately bring to our workplace. Policy coherence, looking at the policy coherence of what's going on in your workplace, and does it actually match up with, I'm going to make this probably too unconcrete in what I say, but does it match up with human rights? Like, are there human rights violations that you're actually seeing in the way international nurses are being employed? Why is it that many of our personal support workers are international nurses with a registration in another country? How do we help to make those changes? And there's a momentum for making those changes now because of the shortage. But I see all of those as being a small but meaningful contribution to SDGs. So I think, Abigail, your point is a really good one. How do we get it down to something that's concrete, specific to our realities in our workplaces, rather than feeling that it's just so big that we're completely immobilized by it, which gets us nowhere. I hope that helps a little bit. And
Yes. Thank you so much. Thank you. You gave me an idea. Thank you very much. Thank you.
Somebody like the idea of working on modules, raising awareness of the 4 SDGs on environmental health. Ashley, what's something undergraduate students can do to promote connection to the environment among the nursing student body at the universities? Well, I think this is off the top of my head, but I would suggest, first of all, getting them linked up to other students whose maybe main focus is environmental issues. Getting them to think about maybe a course that they can take to build some more expertise and competency in that area. I just think that, when disciplines come together, that often, because of our structures in universities, don't meet up, new ideas and innovations come out of it, and students get really excited about that. And they figure out, with mentorship, of course, how to bring that back into their own discipline, and therefore how to strengthen their own discipline. So I think trying to help students build connections, making sure that if there's an environmental student group at your university, that they're open to involving nursing students, because on their side, they may not have thought at all about how to bring in the health perspective on the work that they're doing. So I guess I would start with trying to make those connections as one beginning point. There's somebody who said some of the SDGs has been introduced in global health and community courses, and that's what I'm hearing from many, that's kind of where it's happening. So good that it's happening in my view, but let's not leave it siloed there. Because if we leave it siloed there, then the student who is working in the hospital, for example, when they finish, says, well, what's this got to do with my situation here, and raises exactly the kinds of question that Abigail put forward. Sean, I think you had a comment or a question.
Yes, and your comment just now kind of actually supports that, because in the spring we're planning a trip. I'm from the College of the Rockies, a BSM faculty member there, and we're planning a trip to Denmark, an exchange, which will have a hybrid where we meet with them virtually and then go over there with Aurora College. And a part of that exchange that will happen will be the focus on SDGs. That's what we've kind of agreed to, and comparing and contrasting. So this was very timely, thank you. Contrasting perhaps what a European country has and what they see is at the forefront for SDGs. But the one piece that I really think it would be a great focus is, because at that point, most of our BSN students largely they may not even know about SDGs unless it's been introduced in first year, but really don't have that connection between acute care from where they're largely coming from, because they don't go into community health, global health until third year. So it'd be really interesting for them to be introduced to the SDGs and then kind of connect it to where they came from in terms of acute care across and the kind of focus where they typically don't have that focus, right? Because it seems like it's something that's left for global health or for community. So that kind of sparked light bulbs in my head with regard to a way to focus the assignment between the exchange program that we plan.
Great ideas. And I think looking at ways to help students sort of bridge that connection is really important. And it sounds like you're actively pursuing it through the initiative with Europe, but also thinking about it in terms of the structure of your curriculum.
Yes, thank you. And I appreciate the resources that people are posting too.
Yes.
And hopefully, so I see that this is recorded. Will the presentation be available to get some of those links later on?
Yes, as far as I'm concerned, it can be sent out to everybody.
Okay, thank you.
And I think that's the plan.
Yes, it is.
Yes, and I'm hoping, Dawn, that you're also going to save everything in the chat, because there are some really good resources like from York here and others that would be good to send out to people as well.
All the registrants will receive the recording, and I can add the PowerPoint slides, and Nancy, to that email that I'll send out within the next few days. Is that correct, Nancy?
Super, absolutely.
Okay.
And send out the chat as well, I think.
Very good.
Excellent.
Okay.
So I'm going to, can we just put up our final poll just to get a bit of feedback on this, Cynthia?
Okay, go for it.
Okay, I think you can chat while it's up. So again, if everybody can just respond. I saw another comment in the chat from Susan Duncan about a reminder that we have the ICN Congress in Montreal next year. And I did check the abstract submission, and they do name SDGs, and I think it's objective number 8 of their abstracts, but I'm sure you can build them in elsewhere as well. So it looks like most people strongly agree that they're considering or reconsidering some content about SDGs. So that's terrific.
Okay. So any concluding remarks or ready for closure?
Well, I'll just say that I really do think that schools of nursing can make an important contribution to SDGs. And it's obvious to me that you've got lots of ideas about that. So it's finding the time to make it happen. But I guess it does start with each one of us, and it's finding something that's doable. And it's going to require deliberate planning and action and effort across disciplines and sectors. And I would just say, let's build on the momentum that's already there to address actions arising from the Truth and Reconciliation Commission. I think that is a really good jumping off point for thinking about this. It will strengthen our actions on truth and reconciliation, and it will help us make more advances on the SDGs. Nursing has a lot to offer.
Well, thank you very, very much, Nancy, for this comprehensive and what I've heard a call to action from the profession in nursing education, and I'm motivated. So thank you for a great presentation. We close the webinar.
Thanks all very much for joining us and for your ideas.
Okay.
Okay.
Bye, everyone.
Bye for now.